September marks National Suicide Prevention Month, so we are on your side with things to know that could help save a life. 10 on your side's Lauren Martinez speaks with the Virginia chapter of the American Foundation of Suicide Prevention to talk risk factors, who's at risk, and how to help those in need.
The month-long observance is an important reminder that suicide is a national health crisis and one of the leading causes of death in the United States. In fact, suicide is the 11th most common cause of fatalities in Virginia. According to the Office of the Chief Medical Examiner, in the Commonwealth, there were 1,230 suicides statewide in 2023. And as of September 3rd, 2024, there have been 756 certified suicides accounted for this year.
During the pandemic, there was a lot of focus on mental health, and there were a lot more people reaching out. And I think as people have returned to life, it changes how they're managing their mental health.
While suicide doesn't discriminate, there are certain groups susceptible to suicide more than others.
We do see, particularly in African-American community with youth, young males in particular, there has been an increase. We know that there are systemic issues.
Veterans, LGBTQ individuals, construction workers, and senior citizens also top the list.
The first and most important thing is you're looking for a change in behavior. You are looking for maybe somebody's drinking more than normal. Maybe they're withdrawing from their friends.
But the greatest signal that a person may want to end their life is the very words they speak.
And they'll say things like, I just feel like I'm such a burden, or I'm just so tired, beyond a normal tired. You'll hear people say, life would be easier for those around me if I just wasn't here.
Goller says prevention starts with a conversation, and don't hesitate, as it could save a life. If you or someone is suicidal, contact the Suicide and Crisis Lifeline at 988. It's never too late to call for help. Lauren Martinez, 10 on your side.